little boy? Oh, okay, well, it's not so bad, is it? And will you sit up straight just a little?
I do my best. My name's Kyle, this is Emily, and this is Iggy and Mrs. Pitts, and we're at our home here in Denver, Colorado, in the West Highlands neighborhood here. Iggy as a puppy was super special. In fact, he was a little different than his brother Monty. Monty was pretty much reminded us a little bit of kind of the perfect puppy. And Iggy was really stubborn, I guess is the nice word to use. He growls at just about anything. And typically his growls just, I think, show his stubbornness a little bit. He's not aggressive at all and has never been aggressive. But if you get him to do something he doesn't want to do, like if I pick him up with his head right now, or grab his arm a little bit. That's a little of his growl. You know, he'll actually growl and kiss you at the same time sometimes. So those are things that we kind of learned early on about Iggy the puppy.
We returned home from a vacation, and someone was peeing in the house at night, and our friend that was watching him actually saw him pee. He had come home and they let him out, but he couldn't make it to the door, and he went to the bathroom on the carpet.
We also noticed he was drinking a lot of water, and so we took him to our general practitioner, and you know, really was a really quick diagnosis. I mean, when we told her the symptoms, she, I think, knew to check for diabetes right away.
The initial reaction was first relief, it's not cancer, and then it was, What's
diabetes?
What do we do?
What I wanted to hear most up front was that it was a maintenance disease, and that's what I heard, and I was happy to hear that. We were told then what the maintenance was, and that was giving him 2 shots of insulin every day. And so we listened to her, and we said, okay, we've never given shots to anybody or anything in our life, but we're ready to give her a shot. We were out walking with him one night, and we were walking in a common area that we always walk, and there's an area where we have to go through kind of a walkway, a little door, and there's fences on both sides, and he just walks straight into the fence. And I was like, whoa, maybe it's just kind of dusky time, or I don't understand what's going on. So we walked a little bit further, and we both were watching him on that same walk, and it was very clear that he was having a hard time. So we brought him back again. We showed him the eyes and talked about the trouble that he was having. And she said, you know, started telling us about cataracts and how it will develop if the glucose is not under control. Our generalist said this, I think, you know, based upon, you know, where we are with this, I'm really not comfortable enough to tell you guys exactly what to do. So I want to refer you to a specialist. And that's when we got referred to Dr. Wise.
I'm Lori Wise. I am a veterinary internist. I practice in Wheat Ridge, Colorado. Iggy has diabetes mellitus, which is also called commonly sugar diabetes. So this is a condition where the patient is not able to produce enough insulin. So as a result of not producing enough insulin, the patient cannot control their blood sugar rises. As a result, they need to drink more water, they urinate large volumes, they often lose weight because they're not able to utilize sugar for energy. So they'll break down their muscle and fat to try to get energy. Diabetic cataracts develop in dogs, not in cats, and they develop because the high blood sugar actually enters into the lens of the eye, and then it's converted to a sugar like sorbitol, for instance, and sorbitol then can't get back out of the lens, and then water follows into the lens. And so as the water comes into the lens, then breaks down some of the little fibers of the lens, and that causes a cataract to develop.
Dr. Wise did tell us that there was an opportunity for him potentially to have surgery to remove the cataracts, that she thought he was a decent candidate based upon the fact that he was young, that the cataracts came on as fast as they did. However, what we needed to do is get his levels, his glucose levels, stabilized before they would be able to do the surgery.
So that's why glucose monitoring at home was so important.
Iggy's owners were very interested in doing whatever they could to help him. So they didn't know anything about home monitoring. They had not heard about checking blood glucose at home, but they immediately wanted to start home monitoring, and they did.
So we just have a little monitor, and we need to take a blood sample like any diabetic. You need a little blood sample. You just prick it the inside of the gum right here with a lancet, and then you take the strip and get a little blood sample in there, put it in the monitor, and then you get the reading.
So 167 is his reading, which is right in the normal range,
Yeah.
and the range you want for a dog with diabetes, especially.
It's good,
the way
right?
it's after. It's great. Good man.
Good job, buddy.
You're looking good.
You know, immediately after I saw Iggy, I recommended that they start seeing an ophthalmologist, and they did, and got his cataract surgery done within a month or so of me seeing him, and his vision returned to normal, and he's had great vision ever since.
Iggy's quality of life, he really did change dramatically. The day we got him back from surgery, you could see a change in his personality, and he could catch a ball that next day. So Iggy is having the best time ever.
It's really truly now back to the definition of a maintenance disease. It's simple, 2 shots and that's it. It's really simple and really not too tough on the old pocketbook even. The old pocketbook.
Yep, Gramps.
Really the big message behind Iggy's story is just that seeing a specialist was really an incredible thing for him, because he was able to so quickly get normal on his glucose levels, and then we were able to then have that specialist refer us to another specialist to take care of his cataracts.
I think life without Iggy would just be boring, and I can't imagine it. When I do, it makes me very, very sad. He's just got a really funny personality. He makes me laugh on a daily basis, and you know, he's always there for you, that's for sure.